Thank you so much. Our next panelist is going to be Philip Massey, who's an associate professor in the Department of Community Health Sciences. And we're going to bridge again from traditional media into social media. Thanks so much.
Hi, good morning, everyone. Thank you for inviting me to be part of this panel. So I want a nice segue, Dr. Garfin, to bridge to social media, the most pervasive and participatory form of communication we've really ever experienced. And its use is nearly ubiquitous across all demographic groups and characteristics. I'm sure many of us in this room today have already been on a social media platform, have looked at photos, sent a message, maybe this past week, maybe in the recent past, ranging from the most popular social media platforms such as YouTube, Facebook, Instagram, these are household names, to more niche platforms, Reddit, Nextdoor. Each of these platforms are separate, different communities, unique functions, unique opportunities. One of the more popular platforms as of late, and I say as of late only if you're over the age of 17, is TikTok. If you're under 17, you've known about TikTok for quite some time. It's a very popular social media and has become popular in households for a variety of reasons. If you ask someone under the age of 17 what they think about TikTok, they may say that it's a lifeline. Teens, for all the good, the bad, and the ugly that social media offers, teens in particular often say that it's a space to connect, to be supportive, to create, to share their expression, to advocate, to mobilize. Yes, there are many positive and negative aspects of social media, but again, focusing on the positive aspects of social media, teens really lean, and we all lean on this opportunity to connect and share our stories, learn through others' experiences. And this is really what I want to impart on you today. At the heart of what I want you to remember from this talk is a feeling. Why you go to social media is you connect with others. You go there to feel something. And in health promotion and public health communication, we can really capitalize on this. Yes, sharing accurate information is vital and critical in a timely way, but we can't forget why we go to social media, to connect. And this is happening already on TikTok. When we looked at recovery communities, they're sharing milestones, celebrations, common challenges. And if you look at these TikTok posts, they have over 100,000 likes, thousands of shares, thousands of comments. People are engaging with content. We looked at HPV vaccine posts on Instagram, and engagement is a really critical aspect and concept in social media. And we see when comparing HPV vaccine posts on Instagram that talked about stories, experiences, narratives, they had much more engagement. People were interacting with those posts much more than informational posts. And I know firsthand experience, a parent of 3. If one of my children are sick, have a rash, I need parenting advice about potty training, talking about how our dog died recently. How do you talk to your kid about that? Where do I go? I go to the online parenting group, a trusted source, where I can be open, be vulnerable, learn from people's successes, but also their defeats, their challenges. So this got me thinking back to the HPV vaccine. If you click online, search engine, social media, type in the HPV vaccine, you'll see tons of bad experiences and side effects. What parents want to know are the positive experiences, the joys, the hopes, the trust that getting the HPV vaccine can have on their child's lives. So we set out with a parent advisory board, looking at lots of surveillance work on social media, to develop these personas or ways to communicate about the HPV vaccine through experiences. Gen Xers, millennials who are parents, we use Twitter a lot to look for health information. So these personas, typologies of people to communicate health information were developed for Twitter. You'll see a lot of, well, this is very small, but you'll see lots of demographic information that we clearly identified, but also psychographic information. What is that? What motivates people? What do you like to do on the weekend? What's a fear you have? How can we use that and tap into that in social media to better communicate about different health topics? So these personas, the informed altruist, the supporter, the real talker, and the information gatherer, we created stories and characters around this content and developed it on Twitter. And we wanted to understand, does our content, told through story, experience first, have an impact on parents compared to other informational sources that are critical and vital? So we ran a randomized study. Half of the parents got our story forward messaging, vital information, but story forward, and the other half information. We found a number of things. One, I think importantly, is that knowledge gain was equal in both groups. We're not losing anything when we lead with story or experience necessarily if our goal is knowledge. Now in both arms, whether parents identified or empathized with messages was really a driver of intention to vaccinate, intention to talk to their doctor, intention to talk to their child about the HPV vaccine. Did we answer every question? Absolutely not. But this gave us an opportunity to really hang our hat on the power of story and the power of narrative. Often the reasons we go to social media. Social media is not a magic bullet. I'm not here to tell you that it is, but it's a necessary space that we as public health researchers, professionals, need to thrive in. Misinformation, negative impacts on mental health are a real thing, but there are many positives that we need to leverage as we continue to move forward in public health communication. And working alongside our most vulnerable, minoritized communities, critically important so that we don't perpetuate or create additional disparities in information access. So working where communities are, critically important. And I have to end with my motivation every day I get up. So thank you very much for letting me share these thoughts with you.